right. Okay, so if you remember, the last time we were on page 239, where we had this example. Uh, we are not sure out of the two which worked in favor of our uh, revelation when you tried a new curriculum and we hired a math specialist to teach the new curriculum as well. That means often we might encounter a situation where there could be, um, you know, confusions on, or rather confusions, um, just because we have more than one factors which caused the observed effect. Now, if I just go back to our course in Math 1000, of late I have tried um, to minimize the number of questions in the homework, but increase the frequency. So instead of once a month, now I am doing it once every 2 weeks. But initially I had, let's say, 5 or 6 questions in the homework. But now instead I'm giving you only 2 or 3 questions. So the frequency is more, but the number of questions is less. So I'm trying a new thing. And by the scores, I mean, what you are doing in the homework, I can see a clear improvement. Most of you, as I said, are getting full credits. Okay, now I might be wondering, hold on, is it because I adopted a new technique? I mean, I just changed the format of the homework, or is it the content itself? That means you are actually doing well because the content is easy, or maybe you're getting the contents better since you have already uh, about 3 months with me. Now you already know what type of question I might set up, or maybe you are getting better uh, depth into the concept when I'm discussing, since you already know how I'm trying to excuse me, how I'm trying to go deep into that concept. You already know, and you are actually uh, uh, now getting used to that. So it could be either of that. Okay, it's difficult to understand what actually worked in favor of that improvement in the test score. Not, yeah, even in the test score. I guess most of you know, I have already mentioned it a couple of times before as well, that most of you are doing well in the tests as well. Where in the first test, I guess the scores are not satisfactory, to be honest. But in the last two tests, I mean test 2 and 3, most of you got really, really good scores. So it could be because of the number of questions I have set up. I've been reduced it. I'm trying to take less time from you, uh, so that you still have the full 2 hours, so you can actually spend more time on each question. Or it could be you are actually now, you know, uh, learning it well, learning it in the right direction. It could be because of my teaching. It could be you're working really hard, or you have actually understood what what's the best way to uh, learn this course. So when we have this type of situation, we say confounding occurs. Confounding has occurred. That means when there are two potential variables that could have caused the outcome, and it's not possible to determine which actually caused the result. Excuse me. I'm sorry, I'm pretty sick today. So if you don't understand what I'm trying to say, just let me know, okay? I'll try to uh, say that again. All right. So this is the definition, as you can see, for confounding. Now let's see one more example, and I'll give you time to uh, ask questions if you have any. Okay. So let's say example 22, and let's have the definition just above it as well, so that you can cross-check it. Okay. So it says a drug company study about a weight loss pill might report that people lost an average of 8 pounds while using their new drug. However, in the fine print, you find a statement saying that participants were encouraged to also diet and exercise. Okay, so a drug company launched a weight loss pill. Okay, people start using that. I mean, start consuming that, and after a while, they give feedback that we have lost weights. We have lost weight. Okay, you know, it could be 8 pounds. It could be 10 pounds. Some could lose 6 pounds. Excuse me. So they are giving feedback. So on an average, uh, people are people have lost 8 pounds. You know, you can collect this data from the feedback they have given. So you might be wondering, wow, your pill is working really well, and you can advertise that uh, people has people have lost an average of 8 pounds if or rather after they or rather while they are using your new drug. But since while having this drug, people are also encouraged to exercise and have a balanced diet, then this diet and exercise would also have made this possible, right? You know, if you exercise and have a balanced diet, you can still lose weight. Now, you can clearly imagine that it's difficult to actually understand whether the weight loss happened due to the pill you have launched, or it's because of the diet, or it could be the combination of both, right? It's really difficult to uh, ensure which actually worked. It could be either of that or the combination of both. So since there are more than one factors which could have made it possible, so we say confounding has occurred. Okay, now I'll take a short pause, and I'll wait for your questions. If you have any question, you can go for it now. Excuse me. Any questions? All good? If it doesn't make any sense to you, just Don't hesitate, okay? Let me know. We can try to make things clear. All right, I can't see any questions, so I assume uh, we're doing good. Uh, we're doing great with this.
Oh,
Excuse
I had a general question
me.
if you have a second.
Mhm.
I was just wondering, kind of just looking at like last exams, everything like that. Are we going to have class during finals week or no? Just kind of looking at the end of year schedule.
Sorry, are you going to what?
Just wondering about end of year schedule.
Okay, so I guess the last class is on May 5th, Wednesday. Last day of class. I'm pretty sure that's the last day, but I'll cross check and let you know.
All right, thank you.
Mhm. All right. Okay, example 23. Okay. All right, so researchers conduct an experiment to determine whether students will perform better on an arithmetic test if they listen to music during the test. Okay. All right, so during a maths test, uh, if your instructor gives you permission to uh, have your earphone plugged on rather, um, then after 2 or 3 trials, maybe 3 trials, the instructor have found out that the students are doing better. Okay, so since the students are doing better now, it it could be, you know, because of two reasons. First one, it could be the music they're listening. It might have helped them to solve arithmetical problems better, you know, to keep their mind calm and composed, to let them have full concentration. It often works, that's true. But what if I say that the student now uh, know the format better since they are, as I said, after 2, 3 trials, they have found it. So it could be because of the number of trials they have. After 2 trials or 3 trials, now the students uh, know the format better. They have already uh, had the better of the questionnaire. You might say they are warmed up. They have already had a couple of free trials or free attempts, and now they know how to do better. So it could be regardless the music, right? Excuse me. Sorry, I'm really not feeling well today. Anyway, um, so now the researchers might be in the sweet dilemma to understand what actually worked in favor. Um, whether it's the music or it's the format itself, because they have already had a couple of trials. So we can say that confounding has occurred here, right? Any question? This is really easy though. But when you um, appear for the exam or for the homework, you'll see a similar type of story will be given. And from that, you need to find out um, how many factors could be there. If there is more than one, then you can say that, yeah, there is confounding. If there is only one factor, then you can say, no, confounding didn't occur here, right? Okay. next topic we have is the control group. Now, what's that? Before we go to the definition, oh, sorry, I think I have something in the chat. Hope you feel better soon. Thank you. Thank you. That, that that's so nice of you. Um, okay, where you are? Control group. Okay. So control group um, is one way to reduce this um, dilemma. I mean, uh, most often we'll face confounding because most often there will be more than one factors, right? So we want to control this, right? We don't want too many factors working, uh, you know, in most our researches. That will not give us a better estimation. That will not give us better results. We can't really control every factors. We can't really control every characteristics, but we'd like to reduce the likelihood of the confounding. And for that, one way could be to use this control group. You know, this could be a primary measure to reduce it. Let's see the definition first. Okay, when using a control group, the participants are divided into two or more groups, typically a control group and a treatment group. The treatment group receives the treatment and the control group does not receive the treatment. Now, what does it tell you? How can you uh, actually uh, use it in the examples we have had, at least today in our discussion? So let me tell you the first one, and then I'll let you do the other one. So the drug company actually launched a weight loss pill and they encouraged diet and exercise. Now, to reduce the likelihood of confounding, let us divide the entire population into two groups, where in the first group, you just give them the weight loss pill, and the second group, you say, take the weight loss, take, uh, or rather have a balanced diet and, um, you know, regular exercise and all that. So you can divide your population into two groups. In the first one, you provide them with the treatment, which is the weight loss pill. And in the second one, you doesn't give them that. You don't provide them the treatment. Okay, they don't get the uh, weight loss pill. So now, if you after a while, if you start taking feedback from them, it might get easier to understand what's the reason behind the weight loss, whether it's the pill itself or whether it is the diet and the exercise. So the group which didn't get the pill is the control group. Okay, that means the group where you don't provide the treatment is the control group, and obviously uh, the other group is uh, as we have said, the treatment group in the definition, as you can see here. Okay, now let's see one more example, and then I'll let you do one. Okay, example 24. Okay. To determine if a two-day prep course would help high school students improve their scores on SAT test, a group of students was randomly divided into two subgroups. The first group, the treatment group, was given a two-day prep course. The second group, the control group, was not given the prep course. Excuse me. Afterwards, both groups were given SAT, and whatever the scores were, now, as you can clearly see, it would have been really easy for the uh, school administration to see which group actually did well in the SAT test. It's a tough one, and it requires you to know a lot of maths, do a lot of maths. So, and different things as well. So, if the group where the prep course was given, if that group is doing well, then we can say that the treatment worked in favor of uh, improving the scores. Or if the other group is also doing well, then we can say then the prep course is not the reason. Maybe the students are um, getting better scores because they had a great instructor, or they had a really good curriculum. Okay. All right. So let me go back to example 23. And now I want you to use this control group concept here to reduce the likelihood of confounding. How can you divide um, this population in example 23 to reduce the likelihood of confounding? What could be our two groups, and what could be the treatment? How can you um, use the treatment in those two groups? You can answer voluntarily, and even if yeah.
One group, sorry, one group would listen to music while they took the test, and the other group wouldn't. And the treatment would be the music.
Very good. So obviously the treatment would be the music, right? We have already seen the definition of treatment the last time we met. So definitely the treatment would be the music. When the student listens to music, this could be the treatment group. And the control group, where you don't provide the treatment, right? That means you don't let the students listen to music while they are preparing for the test. Okay, does this make sense? Everyone? Excuse me. Is there anyone who is struggling to understand what's going on? No worries, we can rediscuss, or probably use uh, a better, oops, sorry, a better example to understand it. We're on page 239, right? Yeah, I hope so. Oh, very good. Okay, 240. All right, I can see something in the chat. Let's see. All right, okay. So now, is there any other drawbacks? Is there any other issues which we might encounter when we use this um, control group, or is there any other things that we need to consider when we use this control group? And the answer is yes, of course. We are doing uh, this randomness for a while now, and this randomness has to be here as well when we use the control group, since excuse me, since we are dividing the entire population into two groups. uh, Dividing it randomly and properly is the first issue, right? Which people could be selected for the treatment group, which people could be selected for the control group. Dividing it in the right way could be the first issue you might encounter. And obviously, you need to have randomness here, and obviously, you need to kind of have a stratified sampling, because uh, you actually have different categories, and you don't want to miss out any of those. You at least need to have one from each categories. For example, for the maths test with the music as the treatment, uh, you can have several categories, right? Like age groups. You could have you could have people of different age. So you need to have at least one from each age group. Okay, you can have females and males, so you need to have at least one from each gender as well. You most likely need to have uh, if possible equal number of male and female, right? Equal number of people from each age group. So which actually gives you uh, a better estimation, since you are considering all the factors. But again, uh, as we have discussed it before as well, it's not possible to control every characteristic. It's not possible to make sure every uh, group is exactly same. Both the group has exactly same characteristic. But yeah, the the closer it is, uh, the better result you will get, the better estimation there will be. Okay, and definitely for this you need to have randomness. Okay, so that you are not biased to any of these groups. Okay, you can't be biased towards any of these groups. It will not give you. It will not provide you a better result. Okay. All right. Example 25. A company testing a new plant. Okay, food grows two crops of plants in adjacent fields. The treatment group receiving the new plant food and the control group not. The crop yield would then be compared. By growing them at the same time in adjacent fields, they're controlling for weather and other confounding factors. Okay, now what is uh, the issue here? First of all, they have launched a new plant food, okay, which helps you grow two crops of plants in adjacent fields. So you have, let's say, you have two pieces of uh, fields where you can grow crops, and this plant food helps you grow two crops in those fields, and they are adjacent, they are next to one another. Okay, okay, now since you have two fields, you can use one for the treatment group and the other one for the control group. Now simply the treatment group would receive the treatment, which is the new plant food, and obviously the other group will not. Okay, but yet again, they will encounter different issues. Other than this planned uh, food, uh, even the quality of the soil could be different. Even though adjacent, uh, they could have different uh, quality in the soil, and obviously there will be some other dominating factors like the weather. Okay, but yeah, the weather will be same for both the pieces of land. That's that's not a problem, but it could be an issue I mean, if the weather is good, you generally have better crop, right? If the weather is suitable, I mean, whatever you are trying to grow, if the weather is actually suitable for that, it's not extreme, or it's not really bad. It's not really snowing too much, or it's not really raining too much. It's not really too dry. You know, if those things are not there, I mean, the weather if the weather is suitable, then you generally have a better crop, whether or not you use anything. So, excuse me. So even though you have used the new plant food, because of the weather, you could have a better crop. Okay, or you could have uh, other confounding factors as well. We can't really go deep into that, but you can imagine, if you are from the uh, agricultural study, you could actually find out a couple of other factors as well, which works behind growing a better crop. So often, as I said, even if you have control group, still you might have other factors, uh, other confounding factors. Okay, but yeah, we generally try to subdivide the group in a way so that we encounter less factors, while we move on. Excuse me. Okay, any questions so far? Excuse me. Anything you'd like me to rediscuss? Okay, how are you dealing with this course so far? I mean, we're almost to the end. We have two more discussions on Friday and on Monday, and on Wednesday we'll have a review session for the exam. Excuse me. And I guess we'll probably start reviewing our stuffs on Monday. I don't think we'll need full two discussions to complete this course. I guess we have only one more topic, which is this placebo effect. I think this is the last one we have. Oh, okay, we have one more, blind studies. Okay. Yeah, I don't think we'll need 2 more days. Probably within uh, um, Friday, if not within the first half of Monday, if not within Friday, uh, we'll be able to complete our discussion. So I hope I'll start reviewing the materials um, on Monday, if not definitely on Wednesday. Okay, how are you dealing with the contents? Whether you're finding it too hard, uh, whether it's confusing sometimes. Oops, seven. Or whether you have any other suggestions for um, the last two discussions. You know maybe we could improvise something, or use different tactics if you want. It could be a general overview uh, of the materials if you want. All good? Oops.
I have a question.
Sure, yeah.
When did you say the review is for the final?
Well, I'll definitely have a full review session on Wednesday, the last lecture, which is, I guess, May 5th, last day of class. Um, but I believe we can start it earlier. I mean, we have only two more definitions to see, to observe. So probably we'll start reviewing on Monday, you know,
Okay, thank you.
provi- provided we have finished our topics. But if we can't finish it uh, in the first half of Monday, then I guess I will start reviewing it on Wednesday. Okay, let's move on. If you have any question, you can always unmute yourself. And I apologize for the inconvenience. I'm having a hard time to speak, and you can see, uh, and probably you are getting irritated because the number of times I have, uh, stumbled while I was talking. I apologize for that. Let's go to the next definition. Okay, before that, let's see why we need to know this. Okay, so as we have seen in example 25, um, the control group might not be enough to completely control the confounding variables, right? There could be other factors. There could be other confounding factors. We have already seen that. Okay, so for um, getting a better result, we once again need to improve our situation. We want to use another method which could lead us to the estimation we actually desire. Okay. Okay. Now, um, let's see one example before we move to the definition. Okay. So, for example, if you launch a new pill which uh, reduces, let's say, your headache, okay, and what you do, you subdivide the population. Maybe uh, your population is the number of students in Math 1000, okay, and there are 38 students uh, in this course, and out of this 38, uh, you randomly pick up, let's say, 10 students, okay, so that's your sample, right? If you know the definition. Okay, now you subdivide it into two groups, five each, um, and then your treatment here is definitely the new pill, right? Uh, to the treatment group, you provide this pill which reduces headache, and to the control group, you don't provide it. Okay, you give nothing. Okay, now after a couple of days, you start taking feedbacks from them, from the students of each group, and even if you can see improvement in the uh, treatment group, that means the students feel better after taking the headache pill, you actually could ask yourself, hey, is it because of the pill, or is it because they have taken proper rest, or they have taken any other pill, or they have taken any other measures? What if it's not because of the pill, it's because of any other effect? Or even it could be, uh, since they are chosen, you know, for the treatment in the first group where they were given the pill, one or two students might feel privileged since they were chosen in that group. and they could feel better just because of that, or they could give a good feedback that, yeah, that pill is really working well. What if? What if that influenced them to have improvement, or to show improvement rather? So this effect is called placebo effect. Okay. Now let's see the example, and then we'll, sorry, the definition. Then we'll go back to the uh, next example, or probably we'll come back to this particular example again. Okay, the placebo effect is when the effectiveness of a treatment is influenced by the patient's perception of how effective they think the treatment will be. So a result might be seen even if the treatment is ineffectual. Now, can you relate this definition to the examples we just had? Can you relate this? Can you understand why this could be, uh, this effect could be actually there, even though you have already subdivided your uh, population into two groups, your sample precisely into two groups. So you can see the effectiveness of a treatment might be influenced by some other factors, right? Spatially, it depends on the patient's perception. Excuse me. Okay, let's see one more example, and let's see whether it makes things clear or not. Okay, example 26. Okay, a study found that when doing painful dental tooth extractions, patients told they were receiving a strong painkiller while they actually receiving a salt water injection found as much pain relief as patients receiving a dose of morphine. Okay, now how can you um, use this example with the definition you know, with the definition you just have above this example? Anyone? Can you make connections between these two? What could be the reason we have used this example? What are the effects you could see, if any, of course? No one? Okay, so simply, as you can see, uh, it's not only the painkiller itself, okay? It's actually they they have uh, they have injected salt water, okay? And this is providing them relief, because tooth extractions, if you have done it, you know how painful it is. If you haven't done it, thank God, it's a terrible experience. I've just done it once. I had a slight dental problem a couple of months back. So it's really a painful thing to experience. But again, receiving the painkiller and receiving salt water given them almost equal amount of relief. So that's actually not because of the medicine, it's actually uh, their perception, right? So you can say there is a placebo effect. Okay, we'll come back to it. I don't want to hold you anymore since a couple of you have a class right after it. So next time when we meet, your job will be to go over uh, the definition on page 241 and example 27 and 28. Okay. All right. And again, I apologize for the inconvenience. I hope we'll meet on Friday.